Hi, I'm Dr. Mark Lim from the Artisan Clinic, and if you are thinking of getting lip fillers, then this is the video for you. Most common complaint I do get is that they find that their lips are a little bit too thin, or they find that their lips are not in proportion to the rest of their face. It's getting increasingly more trendy for women to request for lips that are maybe a little bit more 1:1 kind of ratio. I usually like to counsel them, to tell them that, yeah, sure, maybe it may look trendy right now, but it's not like an evergreen kind of look. So I'd like to just answer some of the questions that we see here on Reddit. What is the best lip filler technique to enlarge smallish lips? I feel there's no such thing as the best lip filler technique. At the end of the day, it depends on the injector's hands. If I would like to volumize the entire lip with just minimal kind of injections, then I would favor a cannula approach. By just using 2 entry points at the sides of the mouth, we can cover both the upper as well as the lower lip. My preference for lip filler injections would be to start small. I do not inject more than 1 ml of filler per session. I would rather my patient come back every 2 weeks for small touch-ups so that we can get a nice and very natural result without too much swelling. So we have a post on this lip fillers. This is obviously a very unhappy patient. She says she hates her lip fillers. What I like to do with my fillers is, first, my priority will be to restore the symmetry. So I like to make sure that both sides of the lip look equal. Number 2, most of the volume should be in the red part of the lip. That's the most natural kind of appearance that we look for, rather than to try to enhance the border too much. And that is the problem that this patient is experiencing, where she has too much of the filler in the white part of the lip. When I like to volumize lips, try to place the fillers more centrally. So I usually will use the corners of the nose as a landmark, and I like to place most of my fillers in the center, where between the lines drawn down from the corner of the nose. This gives the most natural kind of appearance and avoids the problem that we see here in this photo. Another common question that we get in the Reddit thread is, how common are bumps after lip fillers? I would say that there are 2 types of bumps. The first kind of bump is a bruise, which is fairly common, unfortunately, because the lips are a very vascular area, and depending on your technique that you choose, if you use sharp needle to inject, you're more likely to get a bit more swelling and bruising. The second kind of bumps that I think people are concerned about because of filler quality, depending on the brand of filler that you use, certain brands are prone to causing bumps or granulomas. These sometimes take weeks, months, or even years to go away. I think the choice of brand for your lip fillers is extremely important. Is there a maintenance when getting lip fillers, or is it a one-time thing? Unfortunately, fillers are not permanent, so dermal fillers, they usually last for a range of 6 up to 12 months, depending on the patient as well as the product choice. The second important factor would be mobility of the lips. So the lips is a very mobile area. We tend to chew our lips, we tend to talk, we make a lot of actions with our lips. When this happens, there's a bit of mechanical stress on the fillers. And with more mechanical stress, this translates to a faster wearing down of the filler. I think in most patients, if you can get your fillers to last for about 9 months to 12 months, that will be a good result. For all my millennial patients here on TikTok, I've seen this lip filter trend going on. So certain lip shapes may not be attainable for everybody. So I think it's important that you and your aesthetic doctor set a realistic expectation for your treatment outcome. Choose a doctor that is able to advise you on what is the best shape for your face. I must say that it's pretty interesting. However, the after effects, the general volumization of the lip, some people actually look worse off than when they started. To sum it up, we often think of volumization in the temples and the cheeks, but don't forget to volumize the lips.